Hi, my name is Tracie Jones, and I am going to perform a comprehensive patient physical assessment. So I'm going to start off with my patient, and I'm just going to take a general survey of her. I'm going to assess her posture. I'm going to assess the way she's dressed. She seems to have a good posture. She appears to be well groomed. Her personal hygiene appears to be good. She appears to have intact skin. I don't see any bumps or bruises anywhere. I don't see any open lesions, just as a general survey. She appears to be in good health, doesn't look to be malnourished. I'm going to ask the patient if she knows her name.
Jane Doe.
And do you know where you are right now, Jane Doe?
Yes, the doctor's office.
Okay, and what year is it?
2018.
Okay, so the patient appears to be alert and oriented ×3. She has good speaking manner. She doesn't have a stutter. She doesn't appear to have any aphasia. So I'm going to move on to health promotion. I'm going to ask, do you have all your immunizations up to date?
Yes.
Okay, and did you get a flu shot last season?
Yes, I did.
Okay, and we suggest to have a pap smear, given that it's normal every 3 years for anybody above 21. When was your last pap smear?
Last month.
All right, and have you ever had a mammogram before?
No.
No. Okay, and you aren't 50 yet, correct?
No.
Okay, so we suggest starting mammograms at age 50. Does anybody in your family have a history of breast cancer?
No.
Okay, so the patient is less than 50. There's nobody in her family that poses a significant risk that has any history of any breast cancer. Colonoscopies generally start at age 50, and that tests for colorectal cancer. And they suggest that you get a colonoscopy every 10 years. Self-breast examinations are not recommended anymore, but what is recommended is self-breast awareness, and that is being aware of any changes in your breasts. Have you had any of that at all?
No.
No? Okay. So the patient seems to be updated on her immunizations and all of her tests. I'm going to go ahead and move along to the head. I'm going to check the patient's hair, her scalp, her skull. I'm just going to touch your head, okay?
Mm-hmm.
I'm going to feel for any kind of lesions, any masses. It appears to have good symmetry. I don't see any open sores on her head. Her hair doesn't feel overly brittle. Okay, and so I'm going to test cranial nerve 5. I'm going to just touch your face and see if you can feel it.
Yes.
Okay, so she has sensations in her face, and I'm also going to test her facial expressions, which would represent cranial nerve 7. So can you smile for me? Can you frown? Blow your cheeks out? Okay. Good. So cranial nerve 7 appears to be intact. And moving along, I'm going to test your temporal mandibular joint. I'm just going to feel your jaw right here. I'm going to ask you to open your mouth up and down. Feel like you're chewing. Okay. So I don't feel any kind of popping. I don't feel any clicking. Can you go side to side? I don't feel any kind of grinding in her temporal mandibular joint. That appears to be within normal limits. I'm going to move along to the eyes. Her eyes appear to be in alignment. They appear to be in good position. I'm going to assess her external eye structures. I'm going to take a look at your eyelids. And I'm going to take a look at her conjunctiva. So her conjunctiva appear to be normal. There doesn't appear to be any styes or drainage, swelling, infection. I'm going to take a look at her extraocular eye movements, and this will also test cranial nerve 3, 4, and 6. I'm just going to ask you to follow my finger with your eyes. Okay, so she was able to do that, and cranial nerve 3, 4, and 6 is intact. I'm also going to test her peripheral vision, which would represent cranial nerve 2. So let me know whenever you can see my hand.
I can see it.
Okay.
I can see it.
Okay, so cranial nerve 2 appears to be intact. She has peripheral vision. I'm going to test convergence with the finger test. Just look at my finger and follow it. Okay, so her eyes converge very nicely. Her conjugate movements, as you can see, they were intact. I'm going to test her corneal reflex with this Q-tip. So I'm just going to lightly touch your eye with this Q-tip. Okay. So that appears to be intact. I'm going to take a look into your eyes with this flashlight. I'm just going to shine it and make sure that your pupillary response is intact. Okay. Okay. All right. So the patient's pupils are equal, round, reactive to light. I'm going to test accommodation now. So if you could just, I'm going to put this here, and I'm going to ask you to look at the back wall, and then I'm going to ask you to look at this flashlight, okay? So look at the back wall, and now look at the flashlight. Okay, so her accommodation is also within normal limits. So if I had a ophthalmoscope, I would check her optic discs. And so moving on, I am going to test her visual acuity. So if you could, I'm going to ask you to step right here where this tape is on the floor, which is 20 feet away from the Snellen chart. And I'm going to ask you what line you can read, cover one eye, and read the line that you can read the best.
DEF POTEC.
Okay, and now cover the other eye.
DEF POTEC.
Okay, great. So it appears that the patient was able to read the 20/20 line vision. So your vision is 20/20, your visual acuity is intact. You can come sit back on the exam table for me. So now, moving on, we're going to take a look at her ears. I'm going to look at her arcals. I'm going to take a look at her eardrums. Okay, so just tell me if you feel any pain, and this will assess for any kind of otitis infections. Any pain?
No.
Okay. No pain?
No.
Okay, I'm gonna take a look inside of her ear canal, make sure that there's not any kind of drainage, any redness. Okay. Okay, there's no drainage, there doesn't appear to be any redness or swelling. If I had a otoscope, I would take a look at her tympanic membranes, which should appear pearly and gray. There should not be any bulging, any redness, any drainage in her ears. I'm going to test her auditory acuity, which will be the whisper test. So I'm going to whisper something in your ear on both sides and tell me what you hear.
Dog.
Okay.
Cat.
Okay. So the patient appears to have good visual or auditory acuity. I'm now going to test for air and bone conduction, and I'm going to perform the Ryan test first. And what I'm going to do is I'm going to tap this instrument, put it up to your ear right near your mastoid process, and I just want you to tell me when you can no longer hear the vibration.
Okay.
And we're going to do that on both sides.
Okay.
Okay?
Okay.
Okay, and now I'm going to perform the Weber test, and what I'm going to do is tap it again and put it up here and tell me when you can no longer hear it, okay?
Okay. Okay.
Okay, and did it sound equal
Yes.
in both ears? There was not one ear that you could hear more than the other?
No.
Okay, very good. So she had a normal Ryan and Weber test. And so now we will move along to the nose and the sinus areas. So I'm going to take just a look at her external and internal structures of her nose. It appears midline. She doesn't appear to have a deviated septum. Have you ever broken your nose at all?
No.
She's never broken her nose or had any nasal trauma. I'm going to just take my flashlight and I'm going to take a look inside of her nose and make sure it's pink. I don't see any type of lesions, masses, there's no open sores, there's no evidence of any drainage coming out of her nose. I'm going to palpate her frontal and maxillary sinuses, so I'm just going to palpate here. Any tenderness?
No.
No? No tenderness?
No.
Okay, so there's no tenderness, there's no pain, there's no swelling. It's all within normal limits. So now I'm going to test cranial nerve 1, and that tests her ability to smell. So if you could just close your left nostril, tell me.
Coffee.
Okay, and close your right.
Coffee.
Okay, so cranial nerve 1 is intact. So now I'm going to move down to the mouth and the pharynx. So I'm just going to take a look at the patient's lips. She doesn't appear to have any blisters, any lesions on her external lips. I'm going to ask her to smile so I can assess her gums. Her gums appear to be nice and pink. There's no sores, there's no lesions. And now I'm going to ask her to stick her tongue out. Her tongue appears to be midline. I'm going to ask her to open her mouth so I can assess her teeth. Okay, so it doesn't appear that there's any cavities in her mouth. Her pharynx appears pink. I'm going to take a look at your tonsils. Her tonsils are, they're not swollen, they're not enlarged, there's no edema, there's no redness. Her mucosa is pink and all within normal limits. I'm going to test your gag reflex, and this will test for cranial nerves 9 and 10. So I'm just going to put this tongue depressor in your mouth. Okay, so the patient does have a gag reflex that is intact. I'm going to ask you if you could just stick out your tongue and move it. Okay, so cranial nerve 12 is also intact. Can you perform a swallowing motion? Okay, very good. So her pharynx was pink, her tonsils were non-enlarged, non-tender. Now we're going to go ahead along and assess the neck. We're going to start by testing out cranial nerve 11. So I'm just going to ask the patient if she can shrug her shoulders. Okay, and we'll assess the range of motion in her neck, forward, backward, side to side. Okay, so now I'm going to assess the patient's trachea. Just by looking at it, it appears to me midline. Sometimes if the trachea is not midline, it can suggest a possible pneumothorax. I'm going to take a look at her thyroid and palpate it. And it doesn't appear that there's any induration or masses. There doesn't appear to be any signs of goiter. I'm going to assess her lymph nodes. I'm just going to touch your neck, okay?
Mm-hmm.
So I'm going to feel her submental lymph node and her submandibular, her preauricle, and her retroauricle. I'm going to assess her post-cervical chain, her anterior cervical chain, and then her supraclavicular. Was there any pain or tenderness anywhere? Okay, so there's no pain, tenderness, there was no swelling, there was no induration. So that's all appears to be within normal limits. So now we're going to move down to the lung and the thorax area. So just looking at the patient, I'm just taking a survey of her anterior to posteriorly. She doesn't appear to have a barrel chest. She doesn't appear to have emphysema. Can you take a deep breath in and out for me? Okay. And I'm just going to assess her lung expansion to make sure it's symmetric. Take a deep breath in and out for me. Okay, all right. And I'm going to take a look at her spinous process and assess for any kind of scoliosis, kyphosis, lordosis. So I'm just going to take a look at your spine. So her spine is midline, within normal limits. There's no evidence of any scoliosis. I'm going to assess her tactile fremitus. So I'm going to just put my hands on your chest and I want you to say the word 99, okay?
99, 99, 99, 99, 99.
Okay, and I'm going to do that to the back side of you too, okay?
99, 99, 99, 99,
Okay, if you could just lift your arms up.
99, 99.
Okay, very good. So she appears to have normal resonance. I'm going to now listen to her chest sounds and also test the transmitted voice sounds. So if you could just say 99 again.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, very good. No abnormalities found, and I'm now going to listen to her breath sounds anteriorly and posteriorly. So if you could just take a slow deep breath in and out for me. So to the back of you. Okay. So her lung sounds are clear. There was no wheezing. There was no crackles, no adventitious breath sounds. So now I'm going to percuss her chest just to make sure that there's no areas of increased dullness, no signs of consolidation or pneumonia. So I'm just going to tap on your chest, okay?
Okay.
Okay, so that all appears to be within normal limits. There's no evidence of any kind of consolidation that I can feel or listen to. Okay, so now we're going to move on to the upper extremities. So I'm going to take a look at the patient's skin, which appears, excuse me, appears to be intact. There's no bruising. There's no signs of any kind of trauma on her arms or her skin. I'm going to take a look at her nails, test her capillary refill, which is less than 3. She doesn't appear to have any kind of clubbing on her fingernails. There's no cyanosis. I'm going to assess the epitrochlear lymph nodes, which is right here. Is there any pain? No. Okay. So there's no swelling, no pain. That appears to be within normal limits. There's no masses. I'm going to assess the brachial pulse and the radial pulses. Right here. Okay, and I'm just going to test your radial pulse. So her pulses are both +2 in her brachial and her radial. I'm going to assess her range of motion in her arms. If you could just, can you put your arms up? Put your arms down. Put your arms forward. Move your wrists. Okay. So also while she's doing the range of motion, I'm also assessing her joints, which appear to be movable, freely movable. Or is there any pain whenever you move your joints?
No.
I'm going to just ask you to move your wrist again, and I'm going to just make sure there's no crepitus. Okay. So there's no crepitus, there's no swelling in her joints, the patient doesn't have any pain. I'm going to assess your grip strength. So if you could just, okay. So she has great grip strength of +4 to +5. I'm going to test her hand-eye coordination. So I'm just going to ask you to take your finger and touch it to your nose. And then the other one. Okay, great. Her motor system, we saw that she was able to stand and appropriately look at the Snellen eye chart. So she has an appropriate gait. I'm going to test your sensory system. So I'm going to first focus on your right arm, and I'm going to touch you with something soft, and I want you to, or I'm going to test both arms, and I'm going to have you close your eyes, and I'm going to touch you with something soft like this, and tell me if it's your right or your left arm, okay?
Left. Right.
Okay, and then you can open your eyes. And now I'm going to test if you can feel sharp or dull. So this is what the sharp will feel like, and then this is what the dull will feel like.
Okay.
Okay? So you can close your eyes.
Sharp.
Okay.
Sharp. Sharp. Dull. 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 Sharp.
Okay. So the patient appears to have intact sensory feeling in her arms. She's able to sense where the feeling is, and she's able to differentiate between sharp and dull. So we are now going to assess your bicep reflexes and your brachioradialis. So I'm just going to take your right arm, and I'm going to tap. Okay, and now I'm going to assess the patient's brachioradialis. Okay, so that appears to be intact. Now I'm going to take this arm, I'm going to tap. Okay, and I'm going to test her brachioradialis. Okay, that appears to be intact. All right. So now moving along, we are going to put a coin in your, oh no, we're not going to do that. We're going to put something in your hand, and you're going to tell me what it is. Okay?
Mm-hmm.
Okay, can you put out your palms?
This would be a pen.
Okay, very good. And I'm going to put something in your other hand.
That would be a coin.
Okay, good. Okay, so that's within normal limits. So now moving along, we're gonna look at the breasts. The patient stated earlier there's nobody in her family that has any signs of or has any history of breast cancer. Has there been any tenderness or masses in your breasts?
No.
Anything outside of your normal self-breast awareness?
No.
Okay. So now I'm going to assess the patient's lymph nodes. So I'm going to assess your supraclavicular lymph nodes, which I did before, and I'm going to assess your inferior clavicular lymph nodes. I'm also going to assess your axillary lymph nodes. And sometimes abnormal signs would be masses, swelling, or tenderness. No pain or anything? Okay, great. So that's all within normal limits. So moving along, we're going to assess the cardiovascular system. So I'm just going to look at the patient's jugular veins. She doesn't appear to have any signs of jugular vein distension in her neck. That could be indicative. That could be a sign of congestive heart failure. I'm going to feel the patient's carotid pulses. I don't feel any kind of thrill. I'm going to feel her precordium. And I'm going to auscultate her carotid arteries and her heart sounds. So can you take a deep breath and hold it for me?
Mm-hmm.
Okay, and then I'm going to take a listen to your heart. I'm going to listen to the apical pulse. Okay, so the patient appears to have a regular rate and rhythm. I didn't hear any murmurs, no grunts, no thrills, so that's within normal limits. We can move down to the abdomen now. I'm going to just take a general survey of it. She doesn't appear to be distended. There's no signs of ascites, liver insufficiency as far as we can see from distension. I'm just going to auscultate her abdomen and make sure she has bowel sounds in all quadrants. Okay. I'm going to palpate her liver and her spleen. Any tenderness?
No.
Okay. I'm going to palpate her aorta. And I'm going to palpate her kidneys. Any tenderness?
No.
Okay. Tenderness?
No.
Okay. So the patient has no tenderness in her kidneys. I'm going to percuss and just so there's no signs of any extra dullness. That's all within normal limits. I'm now going to assess the patient's lower extremities. So I'm going to take a look at her skin on her legs. There doesn't appear to be any ulceration. The patient's not diabetic. She doesn't appear to have any lesions on her feet. I'm going to test her capillary refill in her toes. Okay, which there's her cap refill is less than 3. There's no cyanosis in her toenails. There's no clubbing. I'm going to assess her inguinal lymph nodes, which I'm just going to push right here on your groin, okay?
Mm-hmm.
Is there any tenderness?
No.
Any
No.
pain or tenderness? Okay, so now I'm going to assess the patient's femoral pulses. Okay, she has a +2 femoral pulse. I'm going to assess her post-tibial pulses. And I'm going to assess her pedal pulses. Both of which are +2 pedal pulses and +2 post-tibial pulses. I'm now going to assess her joints and her range of motion in her legs. Can you move your ankles? She doesn't appear to have any kind of ankle edema. Her joints are not swollen. They're not deformed. I don't feel any crepitus whenever she's moving her joints. We'll assess her strength in her legs. Can you lift your leg up? Can you lift your other leg up? Okay, and then we'll assess her strength in her feet. So you could just lift your legs and you're gonna pull towards you. Okay, now can you push? All right, so her push-pull strength is within normal limits and that is intact. She can lift her legs. I'm going to test your sensory and your legs. So I just want you, I'm gonna put a soft sensation on your leg like this, and I want you to tell me left, right, and upper or lower.
Okay.
Okay?
left, lower,
Left lower.
left, lower,
Left upper.
left upper. No, left upper.
Okay.
I was thinking this is upper and this
It's
is
okay.
lower. Right, lower,
Okay.
left, lower, left upper, right upper.
Okay. So the patient's able to distinguish between where the sensation is. And now I want you to tell me if you feel sharp or dull. So it'll be the same. This will be the sharp and this will be the dull.
Okay.
Okay? So close your eyes.
Dull, dull, sharp, dull, sharp, sharp,
Okay.
dull, dull, sharp.
Okay. So her sensations are intact on her lower extremities. She's able to differentiate between sharp and dull on her legs. She's able to lift her legs. She's able to have full range of motion. So now we're going to test her reflexes. So we will test her Achilles reflex on her right leg. Okay, and that is intact. Okay, very good. We will test her plantar reflex. I'm just gonna lift your leg. Okay. Okay, so her plantar reflexes are within normal limits. We will test her quadricep reflex. Okay. All right, very good. So those are all intact. So we will go ahead and move along. I'm going to ask the patient to stand, and I'm just going to assess her gait, her balance. Can you take a couple of steps for me? Okay, very good. You walk backwards a couple of steps. All right, so we can see that the patient doesn't have any kind of ataxia. She has a normal gait. She's able to stand. Her posture is good. Do you have any pain when walking?
No.
Okay. So now we're going to test your spine range of motion. Can you go side to side, forward, backward? Are you able to twist? Okay, so range of motion in the patient's spine appears to be intact. We're going to go ahead and do the Romberg test, and what I'm going to ask you to do is just put your feet together and put your hands by your side, close your eyes. I'm going to assess if you lose your balance. Okay, so the patient doesn't appear to lose any balance at all. We're now going to test your pronator drift. So if you could just hold your arms up like this and close your eyes and just keep them there. What we're assessing for is to see if the patient has any kind of drift, what she doesn't. All right, all good. So you can sit back down. So that pretty much concludes our assessment. Do you have any questions for me?
No.
Okay, well thank you very much for participating and letting me assess you.